Awesome. So, hello again to those of you who are on this webinar and who will be viewing this webinar. My name is Todd Shell Young, and I serve as this year's premedical board member and chair of the National MAPS Committee. We're so excited to keep this series going. Before they were docs, and this week we will be featuring Dr. Antonio Webb, and I'm so excited for him to share his journey with us. I think you all will be inspired. I've always been inspired by Dr. Webb, so I'm pretty sure you all will have the same sentiment. And before we start our conversation with him, as you all know, I like to give a very short and brief introduction to SNMA for those of you who are joining us for the first time. This is our mission. As you can see here on the screen, we're committed to supporting current and future underrepresented minority medical students like yourself, addressing the needs of the underserved communities, and also increasing the number of clinically excellent, culturally competent, and socially conscious physicians. This is critical, and Dr. Webb also is an alum of SNMA, and through his journey and through the doctor's journey that you've already heard, you'll see how much of this is certainly a part of it, a part of the doctors that they are today. And we hope that this will also be you. We also hope that you take this mission and embody it now, because I think it'd be helpful when we all become physicians as well. I also like to give an introduction to MAP, so I won't go through these goals verbatim, but many of you know that uh, for for MAPS, these are some things that we're certainly committed to. We want to ensure that all of you have access to not just knowledge, but also skills and resources such as this webinar. This webinar also serve as a resource so that you can hear people's journeys and also get advice and anything tangible that you need, get your questions answered to ensure that you obtain matriculation into medical school or somewhere in the or some profession within the health field. And we hope that this webinar truly serves as such. And we're just going to jump right in. So, Dr. Webb, thank you so much again for joining us. I'm so happy that you were able to join us during this time. And we want to just literally just jump in with some questions, and I'll ask some follow-up questions as we have this conversation because something actually might spark. But when and how did you know that you wanted to be a doctor? Let's start there.
So that's a good question, and thank you, Todd Shell, for that introduction. So for me, I knew I wanted to be a doctor since I was in high school. I actually was a part of a medical magnet program that kind of exposed me to the field of medicine, and this program essentially changed my life because I grew up a really challenging background in Louisiana, around a lot of drugs and gangs and different types of violence, and it was this program that kept me off of the streets of Louisiana and is the reason why I'm a doctor today. So that's kind of essentially when I wanted to be a doctor since high school.
So that program that you participated in, was it the knowledge that they shared or resources, or were there other black doctors? What was it about that program that really, I guess, helped fast forward that interest or instill that interest further?
Yeah, so essentially it was the exposure to potentially something that I can see myself doing outside of kind of what I saw growing up in Louisiana. And I didn't know any black doctors. I had never met a black doctor or even seen a black doctor. So, um, just being a part of that program and just being around other people who had similar kind of goals kind of just let me know that, hey, this is maybe something I could, try out and maybe I'll like it. And that's exactly what I did. And that's kind of the reason why I try to give back as much as possible and through my YouTube page and feature other black physicians because if people can see, like I just put up a video today about a black neurosurgeon, Dr. Simpson, and I she's the only black neurosurgeon I know. I haven't met any other black neurosurgeon female. So just in that and just having, women or minorities go through the years and you can see someone that looks like you and talks like you have reached that level of success. I think that just can motivate people to reach their goals. So
Awesome. Thank you so much. I'll ask another question as we continue to move forward, but one of the things that we've been hearing over the past couple of weeks is that many black doctors who now that we see as inspirational like yourself, they had not seen a black doctor ever before. So we're starting to learn that this is the rhetoric. And I'm not surprised. I didn't know a black doctor until I was in high school. So thank you so much again for being here because we want to make sure that we are exposing black and brown students to black and brown doctors so that they can imagine themselves as a physician like you are. So definitely wanted to thank you for that. So jump into the next question. What was your pre-medical academic journey like? Was it easy? Did you become pre-med and stop? Like, what did it look like? Walk us through what in pre-med was.
Yeah, I wouldn't definitely say it wasn't easy. It was challenging, to say the least. My background was a little bit different. I actually joined the Air Force at age 17 and spent 8 years in the military before kind of going down the pre-medical path. And while on active duty in the Air Force, I went to school at night time, weekends, took internet courses, just whenever I could take courses to complete my degree. And it took me 7 years to get my undergraduate degree. But just all those years and hard work and, staying up late hours and not sleeping kind of prepared me for medical school and residency because that's kind of the lifestyle you're going to have, trying to reach your goals. And you're going to have a lot of long nights, a lot of sleepless nights but I wouldn't trade it for anything. It just, prepared me for what was ahead. So definitely wasn't easy. It was challenging, but it's all pays off and worth it in the end. So.
Absolutely. And I don't know, I'm not in the military, but I'm assuming that the stamina that you were able to build during your time in the military helped you kind of stay focused and when you were finishing your undergraduate studies. Would you say that was true?
Yeah, absolutely. And, for students who are in college, I think it's important you just take a level of course load that shows the medical committees that you can handle the rigors of medical school. Because, for a certain number of semesters, I would say probably all my undergraduate degree, I was misled and didn't have it, a lot of mentors to bounce things off of. And I was just taking a load of courses where I knew I can get all A's, but the courses weren't that challenging in itself. But I would say take the opposite route and take challenging courses where you can still maintain good grades, but at the same time show the admissions committees that you can handle medical school. Because in college, you take 12 to 15 credit hours per semester, but you get in medical school, you're going to be taking 35 hours per semester. So you just need to prepare yourself for that and be ready for that.
Yeah, and I remember in undergrad, sacrifices that we find ourselves having to make in order to be successful in our pre-medical classes, but discipline. How did you, I know discipline in the military may have been one thing, but, taking the organic chemistries, taking the physics, how did you maintain discipline in order to do well enough to apply?
Yeah, that's a good question. You have to be disciplined and have to be very structured in your studying and your studies. But for me, like I said, it's just the military kind of training. I wasn't the type of person to just lay around or get up really late. Military, we get up really early, and before the sun is up, we had already ran and worked out, and we're already starting work. So I was kind of used to that kind of structure. So it's kind of carried it on from my military career. But I would say just if you have a goal in mind or you're studying in college or medical school, you just have to, number one, take it day by day because, it's a long path. And, I've been in this path since 2009 when I first started at Georgetown. So, it's been 10 years and I'm still in training. So it's definitely a long road. You just have to take it day by day and then, pace yourself with a work-life balance and definitely so you avoid like burnout and all of those things. So, but being disciplined is something that's, will come in handy, especially when you get in residency, because in medical school, you think you don't have a lot of time. you're studying and you're doing research and all these other things. But when you get in residency, you have to work 80 hours a week and then you still have to come home and study. So those years of kind of practicing that before residency really helps. So.
Awesome. And one more question on this question. If you had to define discipline as a pre-medical undergraduate student, how would you define it?
I would say being wholeheartedly kind of structured and also I would say just being wholeheartedly structured in your path and your goals. Just making sure that everything that needs to be accomplished gets accomplished before you go to sleep at night. And that's what I have always done. I don't go to bed until the work is complete. If I need to read a chapter or do questions, no, I'm not going to sleep until it's done. I think that's kind of the definition of discipline for me and along this path.
Okay, I'm pretty sure I just learned something too in that. Don't go to sleep until it's done. So thank you so much for defining that for us. We do have a question. I think it's along this line. How are you able to balance both academics and family and social life? This person said they struggle to find time to spend time with friends and family because they feel like they always should be studying.
Yeah, that's a good question. I still struggle with that even to this day. But that's one thing that it takes a number of years to actually kind of perfect that. I imagine I haven't still perfected that as well, but I think it's important to just have plans for your day. So before my day even starts, I know exactly what I need to accomplish that day. And then if you schedule things in, say for instance, you schedule, 10 minutes to call your parents or an hour to go out to lunch with your family, I think you'll feel less guilty that you're not studying or doing work because everything is scheduled in place. And sometimes I just schedule my studying or my reviewing notes or something like that before I do those things with my family, so I don't feel like I haven't already studied that day or feel pressured to hurry up and get done in my family or resting. So I always try to do some level of studying before I, take some time off. But I think, like I said, I think it's important to just schedule some time in your day for those things. Those things are important. You need your family, you need a support system, you need friends to talk to and bounce off ideas, or if you have a bad day, that's how you're going to get through these long number of years. So.
I completely agree with you. As a working professional, without scheduling things in, like I like to tell the MAPS committee, if it's not on my calendar, it probably won't happen. So, I wish I had that advice as a student because it would have made a whole lot more sense to effectively schedule things in so we can get this studying done. So thanks for answering Milan's question. So the next question is, I know you already mentioned that you went into the military, but this question asks, were you a non-traditional or traditional pre-med student? So after you finished your pre-medical studies, did you go straight into medical school or, did you do a post-bac program or other programs beforehand?
Yeah, so definitely a non-traditional student. I didn't start medical school until I was 27, I believe. So I got out the military, did 8 years, and then I applied to medical school, and didn't get in my first 2 years, and in my third year, I actually did a post-bac at Georgetown, and then got into medical school right after that. So definitely non-traditional, but most people in my class, medical school, were between the ages of 26 to 30, mid 30s or so. The oldest person was like 44. The youngest person was maybe like 22. So, but majority of people were in their late 20s to early 30s. So most people had other careers. I had students in my class that were musicians before, teachers, and all other various kind of professions. So schools really like students who've been out into the workforce or, had other careers before because, they know that this is exactly something that they want to do, especially with a changing career. So.
Awesome. Can you speak a little bit more about the GEMS program that you participated in or the post-bac program at Georgetown for students who are unfamiliar with it?
Yeah, so with me, my GPA wasn't the best GPA. So when I was going through the interviews, this was something that these schools were a little concerned about. And that's the reason why I mentioned, taking a level of course load that shows the admissions committee that you can handle medical school. Because if you're taking, six classes, but, you're taking gym, basket weaving, art, life sciences, and you get all A's, that really doesn't show the admissions committee anything that you can, handle medical school. You need to be taking upper level courses and then still getting A's in those courses. And that kind of shows the schools that you can handle. And that's one mistake that I kind of made. But I'm sorry, tell me your question one more time.
No. You answer. It was basically to speak a little bit more about the GEMS program.
Oh, okay. So yeah, the GEMS program is a post-bac program that's geared towards disadvantaged students that prepares you for medical school. So I didn't know that. I was completely studying the wrong way and how I took tests and conceptualizing. And what they do is they basically break down everything that you do when you walk in that door, and then they teach you from the beginning how to study, how to take tests, how to conceptualize, and essentially that program is setting up for success in medical school. And some of the tools that I learned, I still use to this day. So if your GPA or your MCAT score is not the best, I would look into a graduate program or a post-bac program, and that can show the admissions committees that if you do well in that program, that you'll do well in medical school.
Yeah, and to follow up on exactly what you just said, the question we have here is, for a non-traditional student who actually went through a post-bac program, they are still having issues or, the hurdle of getting through the MCAT and preparing for you. Do you have any advice or recommendations how to effectively prepare for the MCAT as a non-traditional student?
Yeah, everybody's a little bit different in how they learn and how they take exams. I've never been the best standardized test taker, but it depends on how you learn. If you need just the structure or the discipline or someone who is holding you accountable, you can always study with friends. But if you need like the structure and need something that kind of from day by day what to do, then I think a prep course will probably be the best thing. I took Kaplan and Princeton, I took the MCAT 3 times, but, find out which course works best for you. Exam Crackers, Princeton, Kaplan, lots of other courses out there. And everybody's a little bit different in terms of how they study. So I would, look into a course versus, hiring a tutor. And these things are investments because, these MCAT courses are, $3,000, $4,000. But if you look long term, you can make that in 1 hour as a doctor, so it's definitely an investment. I wasn't thinking of it that way when I was going through it. Just like, man, this is a lot of money, $3,000 for a prep course. But, for step one, majority, 90% of people use a prep course. Step two, some people use a prep course, but you're buying Q banks for, your boards. I have orthopedic surgery boards coming up here in a few months. I'm taking a prep course. So just get used to, or try to figure out how you learn best because, you're going to be taking tests for the rest of your medical career. So.
Yeah, I think you just alluded to the follow-up question to that was, do you think that question-based learning is a good method? Because it seemed like test prep courses is just a way of life in the field of medicine, it sounds like. So
Yeah, exactly.
a Q bank would be effective.
Yeah, you have to, I didn't really realize that, or didn't really know, once you get in residency, I thought testing would end, but you still have testing. We still have exams in residency. Every year in November, we have an 8-hour exam that we take. In regards to my specialty is orthopedic surgery. So it's about surgery, pathology, approaches, anatomy, histology, everything. So you have to study for this test throughout the year. And that's what's challenging about residency is that you have to figure out when you're going to study and how you're going to do it because nobody's going to sit there and tell you, hey, you got to study today. You need to go home and study. You need to go home and read. You just have to be very disciplined. That goes back to what we talked about being disciplined.
And you think answering questions, just kind of going through these Q banks multiple times is the best way to do that? Have you seen that now in your residency exams?
Yeah, absolutely. At a board course last year that I went to, there's a gentleman who came and they brought him back because he scored a 99 percentile on his orthopedic surgery boards. And the way he did that was he did 100 questions per day, even working as a resident. So he got up in the morning, he did 33 questions before he even went to work. Throughout the day, like, we had some downtime, maybe between surgeries or you waiting on a patient in clinic. He pulled out his phone and did questions, 33 questions. And then in the evening time, he did another 33 or 34 questions. And he did 100 questions per day for the last 90 days before he took his exam. And I always tell students that the more questions you do, the better, your scores and your grades are going to be. So, definitely questions, kind of pick out what you don't know about certain concepts and what you need to focus on. So the more questions you can do, the better.
Awesome. Thank you. I hope you all heard that because I'll also be taking that advice. So thank you so much for sharing. So the next question is, what organizations helped you along your journey into medicine? Well, I knew that you were a part of SNMA, but were there any other organizations or groups that helped you on your journey?
Yeah, mostly SNMA and there's a couple kind of minority groups around campus and undergrad as well as medical school. And then like a diversity office at whatever institution that you go to is a really good source of contact for different resources. So those are probably most important ones, SNMA.
Okay, if you could remember back to when you participated in the organizations, what were I guess, the most effective thing about the organization that helped you? Was it just exposure to resources? Was it the people? What best worked for you?
Yeah, it's exposure to the mentors as well as people that are already in that field, already went through what you are trying to go through. In medicine, it's all about who you know, really, especially when you're applying for different jobs or when you're applying for residency or you're applying for fellowship. If you know somebody that knows somebody, you can get pretty far. And I always tell, students that, networking is really essential. You have to network with a lot of people who are already in that field. That's how you're going to be successful. So it's all about who you know, essentially.
Awesome. And to the question, I'm happy this person's reading my mind. Did you hold any leadership positions in the organizations? And after that question, were there any mentors that you obtained when you were part of those organizations, especially within SNMA?
Yeah, I don't remember the exact titles, but I did something at SNMA. I was on the executive committee at Georgetown. And then last year I was the vice president of the diversity kind of committee here in Texas. And then a couple other leadership positions, but these mentors, they actually come to the meetings sometimes or the networking events. So those are really good places to meet these people or reach out to them and say, hey, I'm an SNMA, or if you put SNMA in the subject line or that you were part of a certain organization, that catches the person's eye and they'll be more likely to respond back to your email and get back with you. But I think it's fairly easy. You just introduce yourself and say, hey, I'm interested in kind of this, and would you be willing to be my mentor along this process? And most people will say yes.
Yeah, and I want to speak to the question you were like you don't remember which position. So I will say when Dr. Webb was a medical student at Georgetown, I was an undergraduate student, and I don't know if you were president of your chapter, but I do know that you were very committed to MAPS. Every time we bothered you about having a meeting or meeting with the medical students or maybe shadowing or some kind of panel so we could talk to medical students of color, you were always like, yeah, let's do it. And it always happened. So I'm grateful for I guess, I don't know if you want to call it the connection, if you will, that you helped us with connecting us to the medical school because oftentimes we would just do our own thing without the help of the medical students. But when I was there, you were really critical in that. So thank you.
Yeah, absolutely. You're welcome.
And that's for those of you who are listening, reaching back to the undergrads if you're in medical school is also helpful to expose students to medical students of color and also doctors in those medical schools. So let's move forward. So do you currently have mentors? And those mentors, how have they guided you along your way through medical school and through your residency program?
Yeah, absolutely. I think it's almost impossible to get through, the medical path if, people are not kind of guiding you along. I have mentors who are, I'm going into spine surgery, doing the fellowship in that. So mentors who are in the field of spine surgery, have mentors who are, not in orthopedics at all. And also just mentors that, are not in medicine. So I think it's important to have a combination of, various types because depending on what you need to accomplish, that mentor can kind of help you guide you along the way. So, whether it's a financial mentor or mentor that can help you, get into a fellowship or, help you write your essays or whatever it is. So just have a combination or various kind of mentors that you can kind of bounce things off of and kind of help you guide you along the way.
Wonderful. Thank you so much for answering that. So tell us a little bit more about your life experiences that shaped you as a doctor today. I know it seems like we're going back and forth, but sometimes people can think of like one or two very grounding things that's happened in your life that has shaped how you practice medicine and also just kind of, just life in general as a physician, personally and professionally. Tell us more about those experiences.
Yeah, so like I said, I grew up, really challenging background and didn't have I didn't have any mentors or, doctors that I can look at or people that I can look up to in terms of, that had already went through that path. So that's kind of shaped me to the person I am today. And that's the reason why I'm so passionate and, with my careers in medicine kind of series. And I try to feature, females, well, women as well as minorities to inspire people that, are coming after that. Let them know that, hey, this is a black transplant surgeon. I've never met a black transplant surgeon before. So just doing these interviews, that inspires me because I've never met one before. So it's really inspiring to actually just sit and talk to one about his experiences or a plastic surgeon or, various fields. So, that all stems from my experiences of, not having a clear or some guidelines and different directions when I was going through the years. I was just lost essentially going through the years, trying to figure out everything on my own. So that's kind of shaped me who I am today.
And you mentioned, kind of trying to do everything on your own kind of in the beginning. When did you learn that you couldn't do that if you were going to be a successful physician?
Oh, I guess when I got rejected from medical school when I was applying
Okay.
MCAT until after I had graduated from college because I was taking, I think, a biology class, and one of the students I think it was in my senior year. He was saying, "Hey, I'm applying. I have an interview coming up. I'm about to go to an interview." And I was like, "You already applied to medical school? Holy crap!" So I was so lost that I didn't even know that, I had to take the MCAT until after I had already graduated and, or even applied to medical school. And, but I think most people these days, you apply during after your junior year, and so that way you can start after your senior year. So I didn't really know that and kind of set me back a little bit, but that's the reason why I'm so passionate today.
Understood. We have a question. So the question is, how do you stay motivated day in and day out? This person enjoys journaling and some meditation, but what helps you?
Yeah, you're going to need something that motivates you, and whether it's a mentor or people that you can look up to and use as motivation. For me, I think it's important to, when you select a specialty, that you select something that you are passionate about and something that you look forward to getting up every day and going to work. So for me, that's what keeps me motivated, is actually getting up and going to work and doing surgery and helping people who are in a time of, the lowest points of their life. Either they broke a hip or they need a knee replacement or something like that. Those things kind of motivate me, and especially when the patients come back and say, "Oh, you changed my life. I was in chronic pain and couldn't walk and couldn't work, and now, I'm able to go back to work," and they hug you and tell you thank you. Those little small things like that. But if you're in pre-med, just find something that motivates you, whether that's a person or, I wouldn't really use a kind of financial aspect of that, because the time to get to that is so long. But write down in your journal and meditation, all those things are important. But just ask yourself, like, why do I want to become a doctor? And just keep that in the back of your mind when times get hard. And like, most people say, hey, my grandma had cancer and I didn't like to see her struggle. Just think back to those times when times get hard, and that will hopefully kind of inspire you to keep going when, times get rough.
Awesome. Thank you so much for sharing. And, it seems like people's everyday experiences kind of keeps you going too, day in and day out.
Yep. It's a very long road, especially, I'm about ready to be done and been in school for a long time, but, I just keep working towards the end goal. And I look at people who are already spine surgeons and, see how they're, practicing, and that's what keeps me going, to seeing people who are already at the end line. And, they're that's what the good thing about mentors, they kind of push you along and kind of encourage you to keep going. You need somebody like that in your corner.
Wonderful. Thank you so much. We're going to go to the next question, and then we'll go to the questions in the chat box. So, what would you change or improve upon your journey if you had the chance to go back in time?
I would say I probably would have tried to seek out mentors a lot sooner. I think finding someone who had already went through the path that you're trying to go to, they can kind of guide you along the way. And that's probably the most beneficial thing about I did this in medical school, just seeking out, the fourth years or third years when I was a first or second year, and say, hey, how do you study for this exam? What resources that you use? This, surgery rotation, what should I be looking out for? And that's what it's important to just connect with people who are like-minded in your campus. That's why SNMA is important, MAPS groups, all those things are important because of the resources and the advice and everything that you can kind of gain from that. But I would probably just seek out mentors a lot sooner and try to establish more relationships with various people.
Wonderful. Thank you so much for sharing that. So before we go into this next question, which can probably be a little bit big, why did you decide to go into orthopedic surgery?
Yeah, so most people who are trying to decide on a specialty, you either want to go down a kind of, I would say, medical path or a surgical path. So medical is more cerebral thinking, like you may do some procedures like nephrology or some internal medicine, pediatrics. Like I say, you may do some procedures, but the surgical paths where you use your hands mostly, and that's, neurosurgery, plastic surgery, ortho, and all the surgical specialties. But for me, I love working with my hands, and I just couldn't see myself walking around the hospital and just trying to figure out what's wrong with the patient and just rounding for multiple hours throughout the day. I would rather be in the operating room and actually using my hands. So I've always liked the kind of reconstructive aspects of certain things and putting things back together and breaking it apart. And that's exactly what orthopedics is about. It's a lot of hands-on, as well as it's kind of like woodworking almost. A patient comes in with a fracture and their bone is in like 6 pieces, and you have to put it back together like a puzzle and put a plate or a screw on it, some screws or some type of hardware to kind of keep it in place until it heals. So that's what drew me to orthopedics, as well as the aspect of immediate gratification. A patient, has a spine tumor or has a disc herniation and they can't walk and can't work. And I've seen patients come in a wheelchair because of a disc herniation in their back, and we take them to surgery, and a couple weeks later they're up walking and back to work. So those immediate gratification aspects of it, those are the things that are going to keep you kind of going in the long run when the times get hard or, residency gets really tough. So that's why I kind of chose orthopedics.
So I guess my question is, how did you know you were like good at this? Was it during your rotations as a medical student, or you just kind of knew you needed to do something with your hands as a doctor? I'm just curious.
You mean good at surgery?
Like, yeah, just good at surgery and then good at orthopedics because, there are different fields in surgery in itself. So how did you know that you were good at this?
Yeah, I think also you have to match up your personality. So if you go into if you're rotating in a particular specialty and, you're just not, everybody seems a little bit different from what you are and, the personality doesn't match, that may not be a good feel for you kind of first off, but, I don't think anybody comes in, people come in at different levels of dexterity in their hands and aspects of, being a great surgeon, but everybody starts off from, the bottom, and you just have to work really hard and learn how to be a great surgeon. So, even if you may not think you'll be a great surgeon, you have to work at it. And that's how you become really good. You just practice every day. I mean, people who are
Okay. Okay. Thank you so much for
shooter.
that. Uh, can you hear me?
Yeah, I can hear you.
Oh, awesome. Perfect. So I guess the question I was going to follow up was, what does it look like in the day in the life as a orthopedic surgery resident? And I guess with that, there's a question around surgeons coping with stress. And I've always heard that with orthopedic surgery, it's like high risk, high reward. But I'm sure there's so much stress that goes into it. There. I don't know. I don't know. I actually have never shadowed an orthopedic surgeon before. So can you tell us a little bit more about that?
Yeah, so the typical day just varies by what rotation unit you're on. So in residency, we do various rotations. So we may do 2 months of like hand surgery or 2 months of foot and ankle surgery, 2 months of spine surgery, 2 months of, plastic surgery or something like that. So your hours to kind of vary by what rotation. If I'm doing trauma surgery, I'm on call every 3 days. I have to be in the hospital where I stay in the hospital and sleep there. And, if I'm up at night operating late at 2 o'clock in the morning, but that's a more busier rotation. But if you're like, I'm on hand surgery right now, so just, working on hands, the hours are not that bad. So I spend, a lot of my time, doing research as well as reviewing, for cases, surgeries that are upcoming or, for my boards as well. So it fluctuates, on average, you're probably as a resident, 60 to 80 hours per week on trauma surgery, maybe up to 120, 115 or something like that. But it just depends on what rotation. And in terms of, dealing with stress, everybody handles kind of stress differently. Some people are really good, work well under stress, and that's, being in the military and going to Iraq and getting shot at and trying to, take care of patients who are shot. That taught me how to work in really stressful situations. So, and, being a surgeon, you have to be able to handle, stress and be able to, still operate when things are going wrong. So, that just comes with experience, and over the years, you'll kind of pick that up. But, the possibility that there's always a possibility that you can get sued, and they teach us that you will get sued in your career. It's just a matter of when. But, I would just, do the best that you can, learn how to be a good surgeon, treat your patients well as, get to know your patients and communicate with your patients. And that's probably the most common reason why doctors get sued is lack of communication. So that's why I try to focus on and try to establish relationships with patients so you can avoid that from happening.
Awesome. Yeah, I wouldn't even have thought to ask that question. The follow up is, does I know you say you don't really think about it and you know it's kind of going to happen, but does it at any point, like when there's a case that comes in, you're like, oh goodness, this is going to be a little bit complicated. I know I got to do some studying up on this so I can do this well. Does it at any point impact the way that you do the surgery or practice? I don't know if there's an opportunity to like call others in who are potentially more skilled. Does it have any impact?
Yeah, certainly. I think I'll be lying if I said that, that's not in the back of your head, but I think as long as you just do the right thing in terms of the right thing for the patient, you're not doing kind of shady things, which there's a lot of doctors out there that do that. I think you'll be fine. And like I said before, it's communication is probably key. And as long as you do those things and talk to the patient, communicate with them, and let them know, hey, this is what I'm doing, or even if you don't know the answer or know the correct thing to do, just talk to the patient. And most people would understand and can understand that. So, but yeah, there's certainly cases that you have to call your mentors for and bounce things off of or questions you may have, and that's why it's important, like I said before, to establish mentors and seek out people that you can bounce things off of. Because even, once you're done with all your training, I finish my fellowship next year. Even once I'm done with that, I'll probably most likely still have a lot of questions that, that patient may come in. And I was like, man, I don't have any idea what to do with this patient. Or I've never done this surgery before. I need to call my mentor and see what he would do or how he would handle it. So, yeah, that's why mentors are really important.
Wonderful, thank you. I'm so happy we still have time because the questions coming in are actually really good. As a surgeon, what are your communication methods? How do you communicate with the doctors and the PAs and the techs and all the other healthcare professionals that you have to interact with every day?
Yeah, so communication is key, like I said, and it's actually probably one of the most common causes of medical errors. But I would communicate with either the nurse or the PA in a way that they can understand, and also just make sure to reinforce that. And sometimes you have to be very stern or kind of be very assertive when you're doing this, but when the patient's life, is in your hands, then you have to make sure that aspect of the communication gets across and gets communicated well, so the job gets done. But various people communicate differently. I think just being very calm and collected and just making sure that that other person understands what it is that needs to be accomplished, and whether this is, hey, did you understand this, or or just breaking things down to a level that they can understand it as well. Because I can, talk about certain conditions like spondylolisthesis or decompressing the fecal sac, and the nurse may not know what that is. But if I say, hey, we're going to take this patient in and decompress their spinal cord, I'm going to cut some bone and take the bone off the spinal cord. When he comes to your floor, I want you to make sure that he can move his toes, because that may mean that I need to take him back to surgery. So just breaking it down the way they can understand kind of at their level of medical expertise. So I think that's important as well.
Awesome. So I can't even imagine how difficult that could be with like trying not to be very technical to staff who may not understand all the technical pieces of it, even though you probably wish they did. But yeah, I know communication is really, really important. So I'll take this question and then I'll go into the next question because I think we're going to run out of time. The question is, if you were sitting on a medical school admissions committee, what are the top three things you would look for in a competitive applicant outside of their GPA and their MCAT score?
Yeah, so I would probably say life experiences, people who have either done something really extraordinary, like, travel abroad, or when I was going through for residency interviews and also fellowship, I have skydiving on my CV, and most of the interviews wanted to talk about my skydiving experiences. So if you have like scuba dive, you're a certified scuba diver, or if you speak three or four languages, I think that will kind of stand out to me, as well as your personal statement. And having a really strong personal statement can either get you into a door, or they can, reject your application. If people read your personal statement and it's a really compelling one, they would want to meet you. And I had several interviewers say, hey, I read your personal statement. It really touched my heart and I just wanted to meet you. So that's how I got into that interview. So I would say personal statements, life experiences, and let's see, things that you do outside of, I guess, your schooling, like leadership positions and such. So.
Okay, wonderful. Thank you so much for that. So the question kind of that was asked earlier and similar to the one that's here on the screen, if you were speaking to your pre-med self, what would be the five things you would tell yourself right now in retrospect?
Oh man, that's a good question. I would say, um, I would tell myself that it's going to be a long road and there's going to be lots of days where you feel like giving up and you feel like you're inferior to a lot of people. But I would say just tell myself to keep going and keep my head up and take it day by day. Um, Other things I would tell myself um, to have some level of work-life balance. When I was in medical school, first 2 years, all I wanted to do was just study, 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 like, all day, every day. But you have to have some level of balance, and I think that's important. But those are probably the things I can probably think of right now off the top of my head.
Okay. And maybe our kind of wrapping up question might actually spark something else. Like, what are like, I know you probably speak to students often. I know you gave a bunch of major keys in your book, but off the top of your head right now, what are some major keys to students who want to be doctors?
Yeah, I would say what I saw in medical school is like people come from these really good schools and have really good grades and scores, but when they get in medical school, that's a different ball game. And students that when they get into a lot of trouble when they are afraid to ask for help. So I would probably say that kind of another thing I'd probably tell myself that it's okay to ask for help. Nobody gets through medical school by themselves. I studied with three other, med students and we got through medical school together. So, a major portion of advice is to ask for help, that you can't get through this medical path, by yourself. The next one is to essentially never give up because, if it would have took me, 10 years of applying to medical school, I would have applied I first started applying when I was 25, I would probably say. I would have applied until I was 35 because that's how bad I wanted to be a doctor. And if you want to be a doctor that bad, you'll eventually get it. You'll find a way to get into medical school. You just got to keep trying. So um, that's probably my number one advice is to never give up, and despite what anybody tells you. I have counselors that tell me that I shouldn't be applying to medical school, and various teachers and people looked at me crazy when they looked at my application. So, but I just kept going and never gave up.
That's very encouraging. I felt that really strongly I like to call myself a career pre-med since I will be older than what you were when you started medical school when I entered. So that never giving up, even when you start making money. I know some people on the line are, whether they're post back or they finish and they're still preparing to apply. They're working, they're making money, they have a little bit of free time, and then life happens where you kind of have to buckle down and finally get ready to apply to medical school. It's hard. It is really, really hard to stay the course. But when you want it, you want it. It's literally the only thing I can think about every single day. So thank you so much for mentioning that. We do have one question. It seems like we have two final questions coming in, and since we have a few minutes, I'll ask them. So someone said many students identify that they need help for a variety of reasons, but how would you actually go about asking for help?
I would first start off with your mentor or someone who's kind of ahead of you, and see what type of resources they may know about. But most schools have a, office that you can go to. It depends on, what you need help for, whether it's test taking or you're having trouble with anxiety, test anxiety, or if you don't understand certain concepts, but it just depends on what you need help with will dictate where you get that help from. But, you know, the diversity or multicultural office is a good place for most schools. They usually have that and people that you can talk to.
I agree. And also, just ask. One of the things I learned over time is you could either get a yes or no. So just ask the question. And if you're part of, you're part of SNMA, so this is a huge network of students and also physicians who might be able to answer the questions for you or might be able to find someone who can answer that question for you. So just ask the question and find that few or one or two trusted people to ask. And if they don't know, then reaching out to your professional networks is also helpful. Someone just asked a question about your personal statement. The main question is, what did you talk about in your personal statement?
Yes, for medical school, residency, or fellowship.
Probably for medical school.
All right. Medical school, I had a military background and went to Iraq, so that was something that I wanted to, big portion of my life, so I wanted to talk about that. So I think the opening portion of your personal statement is probably the most important because if you catch the reader's eyes in the first few sentences, they'll keep reading. Otherwise, they'll just kind of skim over it. So I kind of talked about my time in the military, and I opened my personal statement with getting shot at. So we got shot at on a daily basis by, rockets and different grenades and, small firearms. And I just talked about that and kind of opened the personal statement, being in that type of environment and how that involved into me wanting to go into medicine to further take care of patients. So that's kind of mostly my military career. That's what I talked about.
Okay, and that probably set you apart from a lot of the students who were applying that year because they probably didn't have that like very, very real life experience that you experienced in Iraq.
Yeah, you have to have something that sets you apart. If you're just in school and living with your parents, you need to have something in your application that's going to set you apart from everyone else, even especially if your scores are kind of about average. So,
Okay. And so the follow-up was, and what about residency? Did you talk about the same thing?
yeah, a little bit, but mostly it's what kind of drew me to orthopedics and that, especially what kind of drew me to orthopedics and same thing for fellowship, what kind of drew me to spine surgery. I talked about a patient that had a condition called central cord syndrome where they're essentially paralyzed after a fall. And we took her to surgery to relieve the pressure on the spinal cord. And I saw her up walking like 2 weeks later. And I was like, man, this is what I want to do the rest of my life. So that's what kind of drew me to spine surgery. But just, find something in your particular application or your portion of your life that you're passionate about because they will ask you about your personal statement. So whatever it is that you're passionate. If you're passionate about cars, you need to put that in your personal statement because people they're gonna ask you about that. So
Hmm. So what I'm hearing is that the story doesn't 100% change when you're going from one, I guess, part of the journey to the other. It seemed like it's a continuous story that keeps on building upon itself. So if there was something, let's say a student wrote about in their personal statement to get into college, is it okay to use that in your medical school?
yeah, absolutely. I went into the military in 2001 and I've been out the military for 10 years now. And for fellowship, when I interviewed last year, I talked about people want to talk about my military time and say, oh, you went to Iraq. Tell me about that. That had to be, pretty challenging. I was like, man, that's been 14 years ago and people still want to talk about it. So, yeah, your life is kind of what you created. So you're going to talk about that and for the rest of your life. And I'm interviewing for jobs now and people want to talk about my military experience still. So, yeah, you definitely use what you use in college, medical school. I use certain aspects of my medical school application or personal statement for residency and same thing for fellowship. So just keep those personal statements. That way you can just modify it if you need to or kind of add to it or vice versa for going along your career.
Wow. Thank you. Thank you. Thank you. Thank you so much. And We did have a question for someone. It seemed like someone's really interested in your field. Are students able to get in contact with you? And if so, what's the best way to get in contact with you?
Yeah, so I think email, overcoming the odds book at gmail.com is probably the best way to get a hold of me. And then, I have a YouTube, Antonio Webb MD is the YouTube page name. And I have various resources and different videos and interviews with various professionals that any aspect of your medical journey, whether you're in pre-med or a medical student, talk about step one and excelling in the hospital, personal statements, what it's like to be a resident, interviewing for fellowship, applying for jobs after you're done, disability insurance. I try to include all of those things. So, yeah, you just Google me and then the email is probably the best way.
Awesome. And I just typed it in the chat box. So just to repeat back, you said overcoming the odds book at gmail.com.
Yep. And YouTube, it's Antonio Webb MD. Just youtube.com, Antonio Webb MD.
Awesome. And I will type that in right now. It seems like we have a question coming through, and this will be the last question. So it's youtube.com, Antonio Webb MD. All right, so there you have it. So I encourage you all to follow him on YouTube, and also here's the email. And I know someone had a question for me, which I will chime in as I close this out. So I just want to say again, thank you so much, Dr. Webb, for joining us. It's really great to hear about stories because for me it's gratifying to know, okay, it doesn't matter how long it takes. If you want to be a doctor, just stay the course. You work hard, you study hard, and you get it done. And you are certainly the epitome of getting it done. So thank you, thank you, thank you, thank you, thank you. Um,
Absolutely. Absolutely.
Absolutely. So I can't thank you enough. But for just to give a few updates as we close out. So this is a part of our Before They Were Docs webinar series for this Black History Month. We do have one more next week with a family physician. Her name is Dr. Kimberly Lawis Scurry, and we're looking forward to closing out our series next week. Also, if you haven't checked out our past webinars, we do have recordings. So if you don't have access to them, please feel free to email me. I'm happy to get it to you, this one and the ones from the past. And if you haven't checked out our past MAPS minutes, which is our MAPS publications, there's still opportunities in there that are not yet. I guess the deadline hasn't reached yet, so I encourage you to take a look at those opportunities. We'll have our 30th anniversary edition coming out very, very, very soon. So feel free to contact us at maps@snma.org if you have any questions. I know someone just asked about MCAT help, and of course, Dr. Webb, if you know of a resource, please feel free to chime in. So with SNMA, one of my roles as your PMBM is to secure pre-medical benefits, and part of that are MCAT resources. So this past couple of months, we had a few trials with UWorld MCAT. They actually gave us 90 days free access to their Q Bank. When I tell you it's incredible, it's incredible. It is pretty cheap too. It's $300 for unlimited access for a year. It was free. Unfortunately, that has expired, but we do have discounts with Kaplan, and we're currently working out our agreements with Next Step. I think that's what they're called, Next Step, and also with Princeton Review, which we will be sending out soon. So if you are a SNMA associate member, you should receive my emails as well as our marketing emails. And also follow our social media, follow our Instagram page because our publications, our Mass Publication Liaison always posts everything. Any discount you can think of that's pre-med, she posts it there. Dr. Webb, do you know of any resources or any colleagues who are doing MCAT prep work? Just to see if you had anything in mind.
Nothing that I can think of now, but if I come across something, I'll email it to you.
Wonderful. Thank you so much. And once again, Feel free to email us. We may be able to answer your questions, and if we can't answer your questions, we will make sure to find someone else to answer for you. So thank you so much again, Dr. Webb, and to all of you who were able to join and who will be watching this. And we'll see you soon. Thank you so much again.
All right, no problem. You guys have a good night.
Have a good evening.